I would like to introduce you to the owner of Full Coverage Private Duty Nursing, the company where I get most of my nurses from. Can you introduce yourself and how long you've owned this business?
Yes, my name is Herman Pippin. I am one of the owners of Full Coverage Private Duty Nursing. We call it Full Coverage PDN. We started this company in 2014. I started my first agency in 1987, and my second agency I started in 2005. This is my third one, and we've been in business since 2014. My business partner's name is David Simmons, and we provide care for patients, mainly patients with tracheostomies and or ventilators. A lot of our patients do have ALS.
Regarding your nurses, how many does your company employ, and what requirements must they meet to work for you?
We have about 150 nurses actively working for us, and they all have to be nurses. That is, they have to be an LPN or an RN licensed by North Carolina or by a state that North Carolina recognizes and allows them to work in North Carolina. They need to have usually at least a year of experience as a nurse probably in a facility. Then they can come out and work in homes by themselves. And one of the main qualifications they have to have is being able to get along with people. That's a special trait. It takes a special kind of nurse to know how to go into somebody's home and strike that balance between guest and professional. I mean, there are a lot of really, really good ICU nurses that you might not enjoy having in your house. So getting along is one of the top qualities one of our nurses has to have. And of course, as a baseline, they have to be able to do all the nursing skills that are required. They have to be able to operate a ventilator, suction someone, use an ambu bag, respond in an emergency, suction, do G-tube feeding, use a Hoyer lift. All the actual skills that are required, they have to be able to do or have to be able to learn. And they really need to be able to think on their feet because they are in the home typically by themselves or only with some of the patient's family members. Sometimes it's just them, and they've got to be able to handle whatever comes up. They have to be resourceful, and it's nice also if the nurse is able and willing to get the patient up, go out and do things. A lot of nurses just physically aren't capable of doing that, but fortunately, patients don't need that all the time of every nurse. So we try to have enough nurses to do that for patients that want to do that. And a big challenge, particularly for ALS patients, is they require essentially all the skills that our nursing pool does with any of our patients. ALS patients typically require almost all of those skills, but those skills need to be a baseline. And from that, the reason I say it's a challenge is that, over and above those skills, ALS patients are mentally active and they want to do things. They want to experience life. And the skills need to be like second nature, that the nurse can just do that. Because if they're having to think too much about their skills, then they don't have the energy, attention, and creativity to put to doing, the things that the patient wants to do just to enjoy life. So that's the short answer.
How many ALS patients has your company cared for?
This company has taken care of 11 ALS patients. My previous companies, I would have to stop and count, but probably over the years, 35 or 40 different ALS patients. A lot of our ALS patients are VA patients, and I would say at any given time, probably about 15 to 20% of our patients would be ALS patients.
If anyone is interested in hiring you to care for a loved one, what is the area you cover, and how is the best way to get in touch with you?
We cover from Greensboro to the coast. That's east and west, and north and south. We pretty much cover, say, from Henderson down to Fayetteville. So kind of a big, broad section of the central part of the state going east. We don't really go west of Greensboro. And the best way to reach us is my cell phone, 919-819-3717, or the office number, 919-803-4000. Or you can reach out on the internet. Our website is fcpdn.com, which stands for, of course, Full Coverage Private Duty Nursing.com. That's probably about the best way to reach us. The most direct way and certain way is the office number, 919-803-4000. Our email is admin, ADMIN, at fcpdn.com.